Hi everyone, my name is Alicia Waldron, and my agency is Rappahannock Rapidan Community Services. And this is a community services board that provides services to the severely mentally ill population, the intellectually disabled population, the substance abusing population, and we also have a unit that serves our aging population within the community. So the agency that I work at serves 5 different counties in Virginia. So we serve Fauquier County and Rappahannock County, and those are the counties that I primarily work with. We also serve Culpeper, Madison, and Orange counties. So we are serving quite a quite a large number of people at this agency. The I believe right now we have about 3,000 clients that are served by the agency within those 5 counties, and they're in various services. Many of them have multiple services as well. So at RRCS, I work as a mental health case manager. And I've been doing this for 3 years now. It's been very eye-opening because uh, I work with the severely mentally ill population, and this is a population that I've worked with since 2009. That's where the majority of my experience is within the profession. But providing services to the SMI population within these 5 counties are difficult at times. We've run into a lot of barriers just with not having resources available for the issues that our clients experience. And in my practicum experience, I am working with the quality assurance department. And mainly in that department, I'm going to be focusing on policies and procedures. And we have a lot of policies and procedures that have not been updated for many, many years. And in fact, I just read a policy that states that we're required to update our policies or at least review them on an annual basis. And that's apparently just not happening, which, kind of goes into some ethical questioning because, are we providing best practice if our policies aren't even up to date? Um, so that's that's been a challenge that I have recently discovered just this week. Um, in the department, I am also working in human rights. So part of that will be investigating reports that come in and just really trying to become an advocate, just an unbiased advocate for my clients or any client that presents with a report, and then finding resolutions when the investigation is complete. So I do think that this is going to be a very exciting practicum. I think that the next few months are going to be very, very busy, and I'm going to learn much more about my agency than I would have just being in the case management role, which is exciting. I think that this is going to be beneficial not only for me and my education, but I'm hoping to, use some skills to help the agency out, even if it is just, reading and reviewing and revising some policies. And in reviewing those policies, I'm also going to be creating some trainings that are going to be used across the agency. So I do have experience in developing and facilitating trainings. I'm really excited about that. And I think that that will definitely help the clients receive services that are hopefully more effective, definitely more grounded in human rights, and more in tune with the policies that are about to be updated. So I'm really excited about this. It's going to be a busy but very productive few semesters. So the challenges that I have observed in the treatment of the SMI, substance abusing, ID, and aging population seems to be from both internal and external factors. So the external factors I mentioned earlier, we sometimes just don't have the resources available to provide what our clients need. For instance, with my case management clients, finding affordable housing in the area that we live in, especially Fauquier County and Rappahannock County, is sometimes nearly impossible. In fact, we do a lot of referring out just to help our clients get housing that's going to be affordable in other counties and outside of our catchment area. The rent is extremely costly in this area, and a lot of our clients who are on SSI or SSDI just simply cannot afford that type of housing. So if family members aren't going to allow them in, and many of our clients don't have interpersonal relationships established to the point that, you know, family members would want them to stay there on a permanent basis, because of, you know, symptomology and lack of education in to some degree with the family members. But, you know, if family members often are not able to take our clients in, then we do have to look at really sending them elsewhere for housing. But, you know, our clients have family in this area, they have grown up in this area, this is where they're comfortable. So that's really a challenge for us. And resources aren't truly available also to help with public housing. We have in Fauquier County one public housing development, and there has been a proposal within the last year to develop another public housing facility, but the board of directors has turned that down, citing various reasons, but overall saying that it would create some challenges within the community, which, you know, us social workers are kind of scratching our head at. Other challenges that I have seen, you know, as far as internal challenges, staff members aren't always available to provide services within the agency. We have recently had to change some of our policies to where we are only serving the SMI population with therapy. And it used to be that, you know, as long as there was a therapist available, we wouldn't look at the SMI diagnosis as critically as we would now. And, you know, we would go ahead and just get clients in to services. But now we do only look for individuals who have that SMI classification of diagnosis. And in fact, we, you know, recently we've had a few therapists who have left the agency. We've had therapists who have retired, taken other positions, and we are not able to meet the need as readily in our clinics as we were able to even a year ago. So most often our clients have to go into the community to find the services that we normally would be able to provide. And another challenge that I have noticed with our substance abusing population is that we do not bill Medicaid for SA treatment. So our clients are having to pay out of pocket, which serves to be a huge barrier with their finances, especially if, again, they're on SSI or SSDI or they're unable to work. So we've tried to advocate in case management, since we do serve dually diagnosed individuals. In case management, we've tried to advocate that the agency begin to bill Medicaid for these services. And in Virginia, Medicaid will fund SA treatment, thankfully. But our agency just has not, made that connection, and the clients really struggle to get the services that they need. As of now, the agency isn't really willing um, to consider billing for that, but we hope that that's going to happen in the future at some point. Um, so we do have a lot of challenges in the agency, and some of it just comes from what services are available, whether we have the staff available, and some of it does turn to politics, within the agency, and we're going to have that anywhere we go. So I am hoping, when it comes to the politics within the agency, I am hoping that my QA practicum position will help me to better advocate for my clients, and in the form of developing those policies and being a voice. I work directly with the clients in my job, so I feel like I can be a voice for my clients if the policy isn't as friendly towards our clients as we really need to be. So definitely looking forward to this, and can't wait to share more information with you. Looking forward to sharing with you in the class, and I'm looking forward to any feedback and responses that you may have. So I will see you all in class. Thanks so much.